ABC News medical contributor and chief innovation officer at Boston Children's Hospital, Dr. John Brownstein, is here now with more on this. Dr. Brownstein, good morning. You work at a children's hospital, so what do you think about this FDA authorization?
Yeah, I think this is fantastic news. 16 million more Americans will be added to the eligibility, and this is really going to help drive us towards population immunity, but more importantly, protecting them. This is an important step in protecting our children. This decision was expected. We knew this vaccine was going to be safe and effective, but if you break down the trial itself in over 2,000 participants, it showed incredible data, right? Antibody titers very similar to older kids, safety profiles incredibly well compared to similar to what we saw in adults, and 100% effective. So no cases in the vaccine group, but 16 cases in the placebo group. So overall, the decision to authorize was basically straightforward, a no-brainer. So important for the kids, but also for who they can infect. Being at a pediatric hospital, this is incredibly important. We have lots of rare and complex and medically vulnerable patients. So for them, this is super important. And for giving them the care that they deserve, this vaccine is going to be incredibly important.
Now, you heard Steve Osunsami there talking about some hesitancy among parents. According to a Kaiser Family Foundation poll, 18% of parents with kids 12 to 15 say they will only vaccinate their kids if schools require it, and 23% say they won't do it at all. So what do you say to those parents?
Yeah, I mean, we need to look at the data. Of course, kids are going to get less sick or die less frequently than adults. But what's happening currently with cases in this country? It has been driven by the younger population. So we know that kids can drive this pandemic forward. And so we need to understand the value of immunizing kids, but also kids themselves can deserve that protection, right? We have long COVID. We have, the concerns about this rare inflammatory disease, but also getting back to normal life. Right? The idea that an outbreak in a school can keep a school closed, kids wanting to remove their masks and getting back to activities like sports and band practice, all these things that they haven't been able to do all year. But, most importantly, kids can transmit. And if they bring it back to the household and you have vulnerable family members, that can get them sick and likely die. So many reasons why we need to convince parents that this is the right option.
But the big concern seems to be that this is a new vaccine. So how do you reassure parents concerned about long-term effects that we won't have seen yet on kids whose bodies are still developing?
Right. I mean, I think this is really important. And of course, this is all about a conversation with your pediatrician to look at the data and really get all the information. Of course, everybody wants the data and to be very comfortable. But we have to remember, these vaccines have been shown to be incredibly safe. The effects very similar to older age groups. We've given over 1 billion vaccines of this Pfizer vaccine to the population. No real safety concerns. And, we've seen it specifically in the 16 to 18-year-old group, and honestly looking like an incredibly effective, safe vaccine. Remember, this EUA process is incredibly rigorous. Of course, we saw that with J&J, so there's no reason to expect that it's any different here. And then, of course, we have this ACIP, the CDC meeting, this independent body that's going to look at all the data on Wednesday and give the thumbs up if that data looks good. So we have multiple checks and balances to make sure that we're giving our kids a safe vaccine.
Do you think that schools will or should require students to get vaccinated? And what does that do in terms of trying to get kids back into the classroom?
Yeah, this is a really complicated one. I think the requirement for vaccine is probably not going to happen broadly. We're seeing it in colleges, of course. This is a state-level decision. We might see it in some schools, but I think we can get there by encouragement, right? We've seen that by showing people that you're getting the vaccine, other people will join in. So parents will see other parents doing it, and those social networks will be super important. But also pediatrician offices, they can play such an important role to remind parents how important this vaccine is for kids, how it can reduce important cases and deaths in those populations, reduce transmission, we're concerned about variants emerging. So there's a lot of reasons why we should be thinking about vaccines, not to mention mental health, anxiety in our pediatric populations. This vaccine can help them all get back to normal life. And it's all about increasing availability. So making sure that we're making these vaccines available in the easiest possible ways to our kids as well. That will also drive demand. Maybe school off days to get vaccines, innovative approaches like we're seeing in the adult population, bringing those to the kids as well.
All right, and I want to shift gears away from the kids because Dr. Fauci said something else that made headlines this week, that masks could become seasonal and that it could be time to maybe relax indoor mask mandates. What do you make of that?
Yeah, I think it makes sense. This is all about following the science, following the data. As cases are dropping dramatically, we're seeing this exponential decline. It makes sense that we can start to do things, especially for those that are vaccinated. We can start to relax those guidelines. We know that if you're vaccinated, the likelihood of transmitting this virus is so low. I think we'll probably still see masking in sort of large gatherings where we know that there's poor ventilation. But in settings where, in smaller groups, and especially if you're vaccinated, of course, I think the masking can start to go away. Now, long-term masking, I think that's an interesting point because, we have flu season, we have other respiratory viruses. Now that we've normalized masking, maybe it's not such a big deal to consider a mask during the height of flu season or, in the height of COVID season. We'll see what happens in the future. We know this happens in other countries where masking is normalized. But ultimately, what we're seeing is because we're doing such a great job with vaccination, because cases are coming down, we're going to slowly get back to our normal life. And that includes removing that mask.
And that's what we want to hear. Dr. John Brownstein, thanks so much. Always great to have you.
Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.